to our speakers. So we're going to hear from Ben Wheeler, who was going to join us but isn't feeling too well, so he's going to join online in a minute. We've got Rachel Turner then here, Tom Shano, and then we'll have a short tea break at 2:30. So we're going to be trying very strict on timing. Tea and cake outside, toilet break, and then we'll be back in here 10 minutes later for a panel, which will be joined by Paula Chappell from Public Health Council and Rob Poole, am I right, from Cornwall Rural Communities Council. Charity. Almost got it right. So they will both be up here as part of a panel after the tea break. We're going to have the speakers and have time for Q&A afterwards, so keep those questions coming. We're trying to have it as interactive and as much discussion as possible. So just before I hand over to Connie to introduce the European Centre for Environment and Human Health, we're very keen to host this today as the Environment and Sustainability Institute, and I'm the director, Jane Wills, because we're celebrating, in part anyway, because we're celebrating our first decade. So ECEHH 10, there you can see our logo. And on our website, this is just a bit of the page where we've got all our events that we've been organising this year to celebrate and mark our celebration. And we've tried to do that in collaboration with all our key partners who've helped us with work over the last 10 years. And our relationship with ECEHH, Polly and Ben are the co-directors. It's based in Truro, she'll tell you about it in a minute. That's been going probably longer than any of the other relationships. So we've been working on things together for a decade, and you're going to hear about some of that work this afternoon. So it's great we're featuring it. If you're interested in other events, you can look on our website. This is pretty much all of them, and you can see there are a big range through from solar engineering, future forecasting, pathogen emergence, a whole range of the kind of work we're doing. And there's also a link to a new newsletter that if you're interested in finding out about events, you can sign up, and then you'll get monthly updates just on the events that are happening. And you're very welcome to come in and join in. We're trying to do things hybrid as well as much as possible so people can join online. So that's enough from me. I'm going to hand over to Connie, who'll say about the European Centre.
Thanks very much, Jane. So yeah, warm welcome for me as well. If you want to put that.
Yes,
sorry, Jane.
I forgot the slide. Yeah.
One little slide. So yeah, warm welcome on behalf of the European Centre for Environment and Human Health. So I'm one of the co-directors, Connie Gwell, and the other co-director is Ben Wheeler. And in a moment, you'll hear him speak about our work. So he's dialing in for us. So as the centre, our vision is to transfer our global understanding of the linkages between environment and human health and really embed sustainability and equity in all our work and the kind of research we're doing at the heart of environment and human health of this intersection. And we really like to build and support a diverse research community to improve understanding, challenge our thinking, and bring about positive change for the planet and the people. And we do incredibly interdisciplinary work to do this. We work with lots of different partners. And as Jane said, it's a real pleasure to jointly host this event today and really join into your celebrations. We had our 10-year anniversary only recently, and it's really great to now celebrate with the ECEHH. And actually, we've always worked closely with the ECEHH. So our team, the AMI microbiology team, has always been based at the centre. So we've always had a foot in the door here over 10 years now at the centre, and it's a really important team to be based here. And there's a real Venn diagram in terms of the work we're doing, in terms of research and the projects. You will hear about that today, but also in terms of the education we're delivering here, and also the kind of stakeholder networks we have locally here in the region, also internationally. So yeah, it's really important that I think we celebrate the work we're doing together. And I leave it at that and would hand over to Ben Wheeler to give the first talk. Yeah.
Thanks, Connie. Ben's going to join us, as I said, from home. So I'm just going to try and sharing so that he can share slides from home. Doing this right, am I? No. Stop sharing. There it is. Stop sharing. Yeah.
Great, thanks very much, Jane. I will just share mine and then we'll be good to go. Okay, hopefully you've got that.
Yeah.
Great. All right, thanks very much, and thanks everybody. Sorry not to be there today. My remit really is to just give us a bit of an intro to thinking around health and wellbeing in coastal communities, and a lot of what I'm talking about is quite UK focused, but it all has sort of implications and relevance globally. So I'm going to talk briefly about some key public health challenges in coastal communities with a focus on the UK, but then move on to talk about opportunities for health promotion and health improvement at the coast, and wrap up with a couple of thoughts around climate change impacts. So what about the health of coastal populations? Well, certainly here in England, some of what I'm going to be presenting here is from the Chief Medical Officer's annual report from 2 years ago, which was specifically around the health of coastal communities. And actually, the graph there is based on census data, so it's self-reported health, but is a really, really good indicator of people's both physical and mental health. And actually what that graph shows us is that the self-reported health of our communities at the coast in England is lower than communities further inland. But I'll say a bit more about that in a little bit. So in the 2021 CMO report, they highlight lots of different challenges and impacts. And it's worth saying that, you know, I think the bulk of that report is focused around the challenges and impacts for public health in coastal communities. And it highlights things like deprivation and health, mental health, migration and demography, health services and medical workforce, economy and employment, education, housing. So lots and lots of different things going on that have a big impact on public health in our coastal communities. And I'm just going to note briefly here that particularly in the panel discussion later this afternoon, one of the key public health challenges for coastal communities that's relevant here in Cornwall and in the UK more widely and globally is suicide. And so when we get to the panel discussion, it's possible there may be some discussion about that. So we just wanted to make people aware that that may well come up in the panel discussion. So what about that? Well, here's a map from the CMO's report on the prevalence of coronary heart disease. So this is data from general practices. So this is kind of like register data based on NHS primary care data, and with quite a clear sort of higher rate of, in this case, coronary heart disease in coastal regions. And of course, here we start to get to a definition of, well, what do we count as coastal in a country like the UK? It's kind of arguable that pretty much most of the country is coastal to some extent. But there's a clear pattern here, and this is something that pops up in various bits of data in this report around higher rates of different kinds of health outcomes in more coastal environments. Of course, within this kind of map, we do have other kinds of really strong geographical patterns going on that are incredibly well entrenched. For example, typically here, the sort of north-south divide, or more accurately, the southeast to northwest divide, that is a very strong historical pattern for health in the UK. So lots of different things going on in that, but at least some pretty clear evidence in the data of coastal excesses in certain health outcomes. And the authors of this, colleagues of ours from the University of Plymouth, just down the road, also sort of wrapped up all those different health outcomes and tried to calculate a sort of coastal effect. So this is having taken account of the older population, socioeconomic deprivation, ethnicity, and other factors, and comparing coastal to non-coastal regions, finding mostly these kind of excesses of the numbers of patients on GP disease registers. And we can have lots of discussions about this and in terms of how the coast is defined or not here. But it's fair to say that we recognise there are a whole bunch of public health challenges in coastal communities here in the UK. And just to think about why that might be, well, we know that, you know, this is well entrenched in kind of public health over decades, if not hundreds of years, in terms of all of these multiple drivers of population health, from our individual characteristics right the way through our communities that we live in, the environments that we inhabit, right the way through to more global kind of environmental conditions. So it's fair to say that, you know, in coastal environments, a lot of these kinds of social and environmental determinants of health are in operation and are having a big impact on the health of our communities. But that's kind of, like I say, that is the bulk of the kind of content of that that report from 2 years ago. But they do say in that report, although this report demonstrates the many health challenges of coastal communities, paradoxically, coastal areas are generally intrinsically healthier. And I think this kind of paradox is perhaps something that we can come back to in discussion, because it's just really interesting to think about what's going on in our coastal communities in terms of the sort of the advantages and disadvantages for public health. And that's relevant around the world, not just here in the UK. So to think about health promotion at the coast, and this is where I mostly focus on research that's come out of our centre over the last decade or so, where we've had a big programme of research on what we might broadly term kind of blue space and health, or blue health. Of course, again, this isn't anything particularly new. So going right back in time, there's a couple of extracts from papers from the Lancet in the 1930s, where they're talking about convalescence at the coast and the potential benefits of coastal environments for health and well-being, right the way back to the sort of 19th century, when we actually had sea bathing hospitals, sort of whole healthcare infrastructure that was built around this idea of kind of the benefits of coastal climates for people's health. So this goes, you know, some way back in time. But bringing this back up to date again, I'm just going to revisit that graph that I showed at the start of the talk, and showing this data from the census, where we show this kind of lower rate of the proportion of the population with good health in our coastal communities. So that left-hand side of the graph is communities within 1 kilometre of the coast, self-reported health being worse in those environments. But the critical thing is that we do recognise that our coastal populations are typically older, and they're typically more socioeconomically deprived than the average. And actually, when we take that census data, once we account for just simply age and socioeconomic deprivation, the relationship flips. And actually, we find that our coastal communities are reporting better health on this kind of generalised self-reported health metric that's around sort of both mental and physical health. So again, a really interesting kind of paradox here between what we're finding here and the findings from that primary care register data from the CMO's report. And what's really important with this work, where we were using data from the census, so covering around 95 to 96% of the whole population, is that actually that strength of that relationship between coastal proximity and good health is strongest in our most socioeconomically deprived areas. So on the right-hand side here, the least deprived quintile of the population, there's almost no relationship at all. So actually, for our least deprived populations, not really any beneficial relationship between general health and proximity to the coast. So there's an argument here, and this is a term that's been coined by folks up in Glasgow, called equigenesis, that potentially are there characteristics of places, of environments that can actually be health promoting to the extent that they actually can help to provide some degree of resilience in health inequalities, and actually potentially help to tackle that. And there's various bits of evidence around now that suggest that might be the case. So thinking about how health might be promoted and improved in our coastal environments, I'm just going to briefly mention this framework This is put together by colleagues at the European Centre around just how blue space health and well-being might be connected to each other through a whole bunch of different routes, whether it's intentional visits to the coast or more incidental kind of exposure, just simply living near the coast, through a whole load of different kinds of mechanisms and pathways, potentially leading to human health and well-being benefits and outcomes. And it's worth saying that this kind of framework is built upon a broader framework that's been developed more generally around nature and health. And typically lots of the nature and health research is more focused around green space and health. And here's where it gets a little bit more specific around blue space and health. So just to give a few brief examples of specific bits of evidence that kind of help to understand what might be going on through the different mechanisms and through different bits of that pathway. Here's a bit of analysis using the British Household Panel Survey. Some people might be familiar with that. So this is longitudinal data following people over time. And in this case, we find basically that when we follow an individual over time, they're more likely to report better mental health in years when they've been living closer to the coast. And the really important thing about this is, you know, the census analysis is very blunt instrument. It's cross-sectional, it's whole population scale data. It tells us a lot, but it doesn't really tell us anything about, especially, for example, what might be a healthy retiree effect. So we know that, you know, perhaps folks who are more capable, who have more resources, who are healthier already, may have more capacity to move to the coast. So the potential for that kind of reverse causality, that healthier people actually move towards the coast. The advantage of this kind of data that follows people over time, in this case for up to 18 years, shows us that it's not a healthy retiree effect, and this is also adjusted for all sorts of other kinds of individual level covariates as well. Talking about physical activity as one of the key mechanisms by which this relationship might arise. This is analysis using Natural England's monitor of engagement with the natural environment. And again, we find here that people who live within a kilometre of the coast are more likely to report getting sufficient physical activity. But what was really interesting actually about this piece of work was the graph there is based on the national data. Actually, when we regionalised the analysis and just divided England up into its different regions, we actually only see this relationship in the northwest and the southwest regions, and we don't see this relationship with physical activity in the more sort of southern and eastern coasts of England. Again, something that really needs picking apart, but really interesting to see this might be working differently in different places. Moving on to think about mental health again, this now going a bit more international. So this is data from the Horizons 2020 Blue Health project that was led by Laura Fleming at the centre. And in this project, we were able to carry out a large international survey of around 16,000 people across Europe and other countries around the world as well. Answering the same kinds of questions as with that mini survey data that we've worked a lot with here in England, but showing the same kinds of results. So suggesting that people who actually take up visits to coastal blue spaces are more likely to report better mental health and well-being. Again, this is cross-sectional, so we don't have that longitudinal data, but it is adjusted for a whole load of individual level variables. And what was really interesting with this actually was being able to show that people, again, there might be some degree of reverse causality here. So for example, perhaps people who are already depressed, perhaps they're less likely to go out, they're less likely to make visits to the coast. And so we see this kind of reverse causality, and the same with anxiety. But actually, at least in terms of what we could do with this data, people who report taking either depression medication or anxiety medication, there's no relationship with between that and making coastal visits. And in fact, there's been some suggestion from some other work that certainly for people taking anti-anxiety medication, they actually may be more likely to make visits to nature, to make those visits out to green and blue spaces. So probably not reverse causality going on here again. And then just some richer data from Sarah Bell here from the centre, sort of qualitative data, demonstrating the importance, amongst many other things that this kind of research can show us, the importance of social contact as a potentially important mediator of the association between coastal visits and health. And that's also appearing in some of the sort of analysis that's still underway using that Blue Health International survey. So a bunch of different mechanisms here by which we might be starting to see, how those potential benefits for population health and well-being might be arising for our coastal communities. And just to reflect again, in this case using data from the Health Survey for England, the national kind of representative health survey, again finding proximity to the coast to be associated with better mental health outcomes. But again here, actually only being able to show that in lower income areas. So again, perhaps suggesting that sort of proximity to or spending time in our natural environments, and in this case our coastal environments, could potentially be beneficial not only for population health generally, but also in that kind of equigenesis kind of way, in the sort of the creation of equality, the dampening of socioeconomic health inequalities. I'm just going to wrap up with a couple of thoughts about climate change. Clearly hugely important as the context for pretty much everything we do now. Certainly when we start thinking about environment and human health, kind of everything's kind of got climate change as a context. And so the most recent IPCC report classified 11 categories of disease and health outcomes, pretty much everything really, as climate sensitive. And that includes direct impacts on health, such as excess heat, and indirect impacts, such as through food systems and other pathways. So to think about how that works at the coast, we can think about coastal vulnerabilities to climate change that inevitably have significant public health impact potential. So we've got those direct routes, we've got things like coastal flooding and extreme weather. We've also got indirect impacts, particularly exacerbation of other risks. So for example, in areas where we might have poor housing quality, quite often the case in coastal communities, perhaps those impacts of heat, damp and cold might be exacerbated. Other things like the fragility of employment that may be dependent on tourism, how will that be impacted by climate change? Water pollution, food security, drinking water quality, all of these things that are perhaps broader climate change impacts may well be particular impacts in vulnerable coastal communities. But also, of course, there is a flip side to this as well, and maybe, just maybe, this is just some work from Portugal that suggested that in coastal environments we might at least find a bit of perhaps dampening of the impacts of heat. So in this case, they were able to sort of use data to show that kind of the heat mortality relationship was dampened a little bit in coastal environments through effectively the huge amount of water acting as a bit of a heat sink and perhaps cooling communities a little bit. So potentially a bit of a flip side there, at least on that front. So that's been a whistle-stop tour of a whole load of really big issues and a few snippets of data. But I think the key things that I wanted to get across were that our coastal communities face a range of challenges that have impacts on public health and significant adverse impacts on public health. And that's across the board here in Cornwall, across the UK and globally. Many of the impacts of more typical social determinants of health, the kinds of things that I've talked about, the kind of things that are really well established in public health, many of those impacts are still present and often, in fact, exacerbated at the coast. But paradoxically, there are also opportunities for health improvement and protection at the coast. And it doesn't seem to be a healthy, wealthy effect. In fact, quite the opposite. There's this potential for equigenesis, this potential for the health benefits of coastal environments, of coastal living, to be particularly felt disproportionately by more socioeconomically deprived communities. So the critical question, and I guess this is a question that's of interest to lots of us here and lots of the stuff that we'll be thinking about this afternoon, really, is how can the multiple challenges be addressed and the opportunities be amplified? Thanks very much.
Okay, thanks, Ben. Much appreciated. If you stop sharing, we can then allow people to put hands up online or in the room if there's questions people want to raise. Yeah. Yeah.
Hi Ben, it's Jackie. I'm just wondering whether a similar effect has been found in sort of like mountainous areas. I'm trying to make a comparison between your coastal communities, sort of relatively low populations, perhaps, you know, seeing a lot of space around you, and what you might see in an inland community with a similar kind of outlook. Is anything been done on that?
That's a great question, Jackie. Not very much to my knowledge. I think there has been some work done. I think it's not as extensive as in the kind of blue and green space literature. I don't know any details of it. I think there's a few bits and pieces around. The only thing that comes to mind actually was, I think, possibly a New Zealand study, which isn't specifically about mountains, but would certainly apply, which was they looked at sort of topography and basically found areas with more hills had lower rates of type 2 diabetes. And we can see how potentially if you live in a hillier area, perhaps people get more physical activity just by kind of default. If you want to go anywhere, you've got to expend more energy if you're walking. So that would kind of make sense and might have a bit of relevance in mountainous areas. But I think, like you say, all the other things may well be in operation there as well.
Any more questions? Okay, I don't see hands. Oh, sorry, Karen.
Hi Ben, thanks for that. It's Karen from Cornwall. I was just wondering about just a finer grain in terms of the people. So I was wondering about, it's a very crass sort of distinction, but local and incomer. Just from personal experience of being in Cornwall and knowing many sort of Cornish born and bred people who never actually go to the sea. And then that leads me to question, what do you mean by the health benefits of being at the coast? Do you mean people who actively go to the sea, see the sea every day, rather than just live within, I don't know, 5 kilometres of the sea? So just a bit more of a fine grain, if you want.
That's a really great question, and I think that's something that I guess the census data, at least, is based on people's residence, and it should be based on their primary residence. People can self-classify that, but that potentially has an impact in terms of second homeowners and stuff. But at least that sort of main bulk of census data should be based on where people live. I totally agree. I think there's all sorts of bits and pieces of evidence and stories, not only from Cornwall, but from lots of other places as well, about people who grow up within a stone's throw of the sea and have never been there for lots and lots of different reasons. And so I think you're right. And to my mind, actually, one of the critical issues is the inequalities issue. And I'm sure that's something that we'll come back to again this afternoon, in terms of, something like, even the sort of large scale analyses that we do are kind of, they have to be broad brushed by their nature, and we can adjust as much as we can for individual characteristics, but there's likely to be different things going on for different people in different places. I guess the thing that I would take away is most of the research that we see that looks at it does find this kind of equigenic effect, this potential for disproportionate benefit for people from more socioeconomically deprived communities, but it's likely to be much more complex than that. And I think you're right.
Okay. If there's nothing pressing, I'm going to hand over now to Rachel and get her slides up. Big thanks, Ben. I did it.
Did you? Is it shared?
Yeah,
Yeah,
there's a red border.
Yeah, I can't tell.
Thanks, Jane.
So, yeah, very pleased to have Rachel doing this next talk. She's a colleague in geography as well as the ESI, and has been doing lots of work in this area for a long time and will have loads to tell us. So thank you, Rachel.
Thank you. So I'm going to talk about the resilience of coastal communities, but with a bit of a caveat that I'm focusing primarily on fishers and fishing communities. So why am I talking about resilience when the title is Health and Wellbeing in Coastal Communities? And the answer to that is really because I think we can see coastal communities as being at risk from a multitude of different changes. So very much at the forefront of changes in society, in economies, in environments, and not least climate change. So communities at the coast are very much facing these intersecting changes. And those changes often have social costs for people's health and for their well-being. And if we're talking about fishing communities, that is already in a mentally and physically stressful working environment. So this is important, I think, the premise of this is that this is really important to understand, because actually, if we want to balance people's well-being and environmental sustainability, it's really people who are healthy and well who are going to contribute to the future viability of coastal communities, of fishing communities, and also to environmentally sustainable practices. So the question behind this talk is really, how can coastal communities better cope with, adapt to, respond to, or transform in the face of some of these shocks and stresses that they're facing? So just to give you a little bit of an illustration of the types of stresses and shocks that I'm talking about, these kind of categories are from some research that we did in Porthleven, interviewing fishers a few years ago, and really just illustrates the range of challenges that people perceive across different scales. So not only changes in the fishery that affect their livelihoods, whether that's local changes or whether it's wider changes like regulation, for example, but also the changes that are happening in their everyday lives, both within their family or their individual circumstances, so things like financial security or other job opportunities, and changes in the community, so people moving in and out, changes in the cost of living, house prices, and so there's a whole plethora of changes that people report facing, and the ones involved we'll come back to in a couple of examples. But we were also interested in trying to understand, well, what are the impacts of these challenges that people face? And we use the wellbeing framework to try and understand these costs, the costs that people experience as a result of responding to these shocks and stresses. We understood wellbeing quite broadly, so including people's objective or material circumstances, the relationships they have either with other people or institutions that might either support them or hinder them in trying to respond, and also their subjective perceptions and their sort of evaluation of their own life circumstances. What we saw from the interview data is that these shocks and stresses really impact people across this whole spectrum of well-being. So just a few quotes here as illustrations. Big one was financial insecurity, and this quote really, I think, puts it very well. One fisherman said, "It's like standing on a boat that you suddenly realise is full of water and you don't know where it's coming in. An unpleasant feeling that you haven't got the security you thought you had." And of course, financial security, as we know, is linked to mental health and lots of other challenges. People also mentioned challenges around governance and being able to have a voice or have a say. They talked about their subjective well-being and how that was impacted by the changing nature of fisheries and fishing communities. And they also talked specifically about their health, both physical and mental. So one fisherman said he went to the doctors and was told, if you carry on like this, you're going to have a heart attack. And other fishermen talked about depression, perhaps even because they've had to leave fishing and they've lost their identity, for example. And importantly, this is not just about fishermen, but has impacts on the whole family and the wider community. Oh, that's the wrong thing. So it's not new that people face shocks and stresses, but I think what's important is that this research is from skipping around continents, I'm afraid. So we started off in Cornwall, we're in Australia now. But fishermen have always faced risks. There's bad weather at sea, there's uncertainty in markets, and so on. But what we also found through this research in Australia is that there are also these new and accelerating risks, which we call modern uncertainties. And a lot of those were about governance factors, changing regulations, a lot of uncertainty about the future, and of course compounded by climate change as well. So I think importantly, what we found through this survey of fishes in Australia is that both of these have the potential to impact people's health. So the more stresses fishes reported experiencing, the higher the levels of psychological distress they reported as well. And so there is this potential that these increasing and accelerating impacts on fishing communities have these kind of compounding or potentially synergistic impacts. And again, many people experience shocks and stresses. So why are we so concerned about fishing communities? And I think from my perspective, one of the key factors around the vulnerability of fishing communities is that they are less likely to access help. So this is again some research that we did in Cornwall, understanding fishers' access to healthcare. And people reported lots of barriers, and many of those were organisational and practical things, but many of them were also associated with social and cultural norms around masculinity, around the culture of fishing, being strong and independent. So for example, 66% of fishers told us, I like to keep my feelings and worries to myself, or I don't like to ask for help. And again, importantly, the more fishers mentioned these types of constraints, the less likely they were to have visited a doctor for a healthcare issue they were worried about. And I think it's also important to add that these kind of dynamics can lead to these kind of vicious cycles. So these are just some quotes from a PhD student who did some research around how fishers respond to storminess. And the first example is that, with increasing financial pressures, it pushes people potentially to take more risk. So this fisherman is saying, truth be told, we shouldn't have been out in this bad weather, but when you're up against it with kids to feed, you make that decision. And this is actually, before the rapid rise in cost of living that we've seen in the last couple of years. And the second quote is really talking about crew. So the decline in crew and availability of crew that people have experienced kind of exacerbates the sort of inherent risk and danger of being out at sea in the first place, because you really need a team that gels together to be safe. And it also potentially, combined with these kind of financial pressures, pushes people to work single-handedly, which is also, of course, more dangerous. So all of that highlights that there are these intersecting shocks and stresses, and that they're having an impact on fishing communities. And obviously, it's really important that we try to mitigate a lot of those stresses and changes. But it's also important to think about, well, what supports people to cope, to adapt, and to transform when these intersecting stresses happen. So how can people's adaptive capacity be enhanced to support their resilience to these accelerating risks? And we're skipping to the Caribbean now. So we had an opportunity to do some research around this question in Dominica, looking at fishing communities after the Hurricane Maria in 2017. And this was a huge hurricane, biggest that they'd experienced for years, and caused catastrophic damage around the island. I think it was, I can't even remember how much money it was. It was multiples of their GNP. So this shows the main fish market, coastal communities, really extensive damage. And we use this framework, which is by Josh Sinner and others put together, to try and understand, well, what helped people or hindered people in their ability to kind of respond and recover to this hurricane. And this is kind of important because there's this tendency to think of the way to support people to be resilient as to provide assets, physical assets and resources. But this framework illustrates that there are so many other factors that help people or prevent people from responding effectively. So assets are, of course, important, and in this case, particularly getting communal assets back on track, so things like electricity, water supply, ice, all the kind of infrastructure that you need for fishing. but also many other things. So one key thing was flexibility. So the fishermen who had the opportunity to either fish onshore or offshore were able to make modifications in order to get back on track sooner than some of the others who were restricted to one type of fishing. In terms of organisation, social relationships are really important in whether or not people were able to respond effectively. And this picture just illustrates that there was a very strong perception of political patronage in the distribution of aid following the hurricane, which was very beneficial for some people, but very much less beneficial for others. The fourth one was learning, and this is really the question of, can people learn from previous experiences to respond to things that are happening now? And I think in this context, it just really highlighted that many of these challenges are very new, and on a very small island, it's very difficult to come up with novel and new ways of responding to the same challenges. It's also an island that experiences multiple different types of hazards, so learning from one thing to apply it to another thing doesn't always come up with solutions. And the last one is agency. So it's all very well having all of these other four things, but if you don't have the kind of sense that you are able to act and make decisions and use these other resources that you have and deploy them to make a change, it's very difficult. So one of the things we found in Dominica, for example, was that there'd been a decline in sort of representative organisations like fisher co-ops, and so individually, fishermen very much perceived that there was a danger or a political risk of being too activist and demanding changes or support. So jumping back to the UK again, sorry about that. I think the other thing that our research has shown is that many people can respond to change and absorb a lot of change and make changes in their lives, but that often comes at a cost. So some research that Lucy Sabuva led uses the example of women in fisheries, thinking about how do women in fisheries make a contribution to enhancing and building resilience to all these shocks and stresses. And they do so in a number of ways. Often these contributions are characterised as help rather than work, but helping out in a number of ways. Subsidising fishing businesses, often because their income can often be greater than fishing income, but also in ways that are often unseen, like maintaining family relationships and social relationships. But often that comes at a cost to people's well-being. So people talked about it being a very hard life. There's a lot of stress, worry, loneliness and isolation, and a sense that fishing and the sea is often prioritised above family life. So this kind of brings us to where we are now in terms of research. So I'm currently working on a project that Louisa Evans is leading called ROC, which is the Sustainable Development and Resilience of Coastal Communities. And it's really trying to understand not just what this relationship is between people's resilience and their well-being and where there might be kind of consequences and trade-offs there, but also what's the relationship between resilience and environmental sustainability. Because if we're going to try and build viable coastal communities where people are well, but also where people are, interacting in a sustainable way with the environment, we need to kind of try and weave these three things together and find ways of building social resilience to change that also enable people to maintain their well-being and to maintain marine sustainability. So that's what we're doing at the moment. We're about to launch about to undertake some research that will look at marine resource users in coastal communities around Devon and Cornwall, and really try and understand, what are the sources of resilience that people are drawing on when they experience shocks and stresses, and what are the potential costs of people either coping, adapting, or responding to those changes, and what are the implications also for the environment. So no answers yet, I'm afraid, but that's where we are now, and I think where we see these questions being really important, tying all these things together.
Great. Thank you. There was loads in there, so many thanks. And questions, comments, online as well. I'll stop sharing so we can see. Yeah, so online, stick your hand up, and likewise in the room, and we can get some questions. That's it.
So Jim from Cornwall. It's a bit of a strange question, this maybe, but I can't but help think of the rhetorical importance put on fishermen and Brexit against their actual economic existence. I mean, did that come up as a topic with coastal communities?
Yeah, and actually Louise Evans, who I mentioned, I helped her with a project that she led actually shortly after the Brexit vote, when there was a lot of publicity around fisheries and the march up the Thames and so on, and we did some interviews with fishermen in Mevagissey and other communities, and I think a really strong theme that came out of those was very much linked to the quote that I illustrated about people's voice, because most of the people we spoke to said it was not necessarily that they were expecting anything to change, but they didn't know what else to do. It was a bit of a last resort. So yeah, I think it is very strongly linked to people's sense of agency and their ability to have a say and a voice in the things that are affecting their livelihood.
Maybe people should introduce themselves, because I've already forgotten your name.
Yeah,
So
my name is Jackie Eels,
Yeah.
researcher at the ECEHH, and also working with you on Rock. My question's a bit about Dominica, and I suppose it's more about, this is a bit of a tangent, but it's about mental health, specifically about like mental health trauma from people who've experienced such an extreme weather event like hurricane. Did you manage to look into that at all? I mean, you touched a little bit on people's agency and maybe a bit on mental health. Anything specifically to do with that kind of major shock?
We didn't touch on that because it was a very short study, and I think that requires a much longer, more sensitive research process than we had the time for. But undoubtedly, it's a major issue there, because there were also, as you probably know, 2 storms a couple of years apart that really had a major impact on people. So people touched on it very lightly, but we didn't go into depth on that issue. But yeah.
Anyone online? No hands up. Yeah.
Hello. Hi, for everybody else, I'm Catherine Myson from CJS. It's not really a question, it's just an observation that on the one hand, we've got people living near the coast get mental health benefit, people who work on the sea are stressed out of their minds. How do we, what I'm really interested in is how we reconcile the idea of the sea and the coast as a position of good, when actually there are people, certain communities of practice who are unbelievably weighed out by the thing.
Yeah, I think it's a great point. I think it's a really interesting tension that hasn't really been given that much attention. I mean, I know the literature on sort of fish's occupational attachment touches on the importance and the benefits that people do get from being at sea, and that sort of sense of independence and freedom that makes people very reluctant to give that up as a career. But then at the same time, there are incredible challenges and pressures on the same group of people.
Occupational deaths are pretty high, aren't they, for fishing? It's
Yeah.
the most dangerous.
We actually did some research with Ben, analysis of the census data from the UK, and fishermen came out as, I think it was the least healthy occupation after miners and one other sort of bizarre category in the census. So yeah, they're really up there.
And Cornwall have both mining and fishing.
Yeah.
Harry's put his hand up now. Oh, so Harry online, yeah.
Hi, thanks,
Hi.
Rachel. Really interesting. Sorry, I should introduce myself. Harry West, anthropology from the Streatham campus, and also lead of Exeter Food. Yeah, just also like some others coming at this, thinking about the comparisons between fisher folk and farmers. And I wonder if you can say a little bit more about the extent to which some of the phenomena that you've talked about, the sort of issues around agency, the reluctance to ask for help, how far do they radiate into the community of people whose livelihoods are bound up with fisher folk? folks who were involved in maintaining boats, folks who are involved in processing the catch, the other livelihoods that are bound up with this. I mean, is this pretty tightly focused around those who go to sea, or is it the entire sector which is somewhat insecure, somewhat vulnerable to natural disasters, et cetera, et cetera? Just wondered if you could say something about that.
Yeah, it's a great question. I haven't really looked at that so much in the UK, but I mean, at least in the Dominica example was really critical and really interesting in terms of comparing or looking at the dynamics between those different groups of people as well. So in Dominica, fishers might have responded in a particular way that led them to, be able to adapt, like selling their catch by the roadside because they didn't have ice, but then actually fish vendors who are predominantly female and work in the markets then had nothing to sell. So there are these kind of rebound effects, I think, around different parts of the industry, but it's not something that we've looked at in lots of depth. Question me.
And Gitty Anchors, hand up online if you want to ask a question. Silence. Gitty, oh, you know them. Gitty, if you're there. While you're warming up, maybe Connie had a hand up if you want to. Connie, I stopped you in your tracks if you want to raise something.
Was I probably asked that was a very similar question to Harris and the others. I guess just questions on, you looked at these all different settings, and is there sort of what are the sort of commonalities? Is there something about being a coastal community that develops resilience? So maybe you don't have to actually go to the sea, but as a community, you build a resilience. So there is a kind of culture of sticking up for each other or something that has developed and is not necessarily connected with the activities you're doing or the particular livelihood you're having, and if that might be seen across different settings.
Yeah, I think certainly in Dominica there were, people talked about it as some villages have done very well in responding because they have had this more collective, cohesive community response and been able to respond to other things together before, whereas others were much more disparate and didn't. I just had a thought and I've lost it, sorry. Sorry, I don't mind.
I was thinking about this same question though in relation to Newlyn, which is our biggest fishing port, and it has that history of Methodism and all that self-organising that went on in the community like that. So there's great hardship and every family lost somebody at sea, but there's also the flip side of that is really amazing self-organisation to build chapels. But then people fall out and they have another chapel and another chapel. So it's highly complicated, isn't it?
Well, you've just reminded me of what I was going to say, which is I think is that it's also tied in with the changing nature of coastal communities. So if you compare it to Cornwall, you've actually got fishermen being pushed out and living outside coastal communities and somewhat of a decline in that sort of community cohesion. So
yeah. We're going to come back to lots of these issues in our panel, actually. So great, thank you, Rachel. I'm going to hand over to Tom, who's going to do our final talk before tea and cake. I'm going to get the slides up now. Did you get the message about your notes not being?
Yeah, that's fine.
All yours.
All right, brilliant.
So, great to introduce Tom Shano, who's also in geography and the ESI, and will, I think, give us a global perspective. Am I right?
Thank you, Jane.
Yes.
Yes, hi everyone. I'll be talking about researching blue communities. I spent a bit of time thinking about what a blue community was, and then I thought I'd use that as my strength and make the whole talk about that. So I'm not quite sure what a blue community really is, and I don't think I ever really knew what a blue community was. But I'm hoping that I'm slightly better off at it now than at researching such communities than I was when I started. This is a picture taken from when I was doing my PhD in the Philippines. And at the time, I thought of a blue community a little bit in this kind of way, a sort of a place where the local culture and economy are driven by the waterways they inhabit. That would be the kind of thing I would have put in the introduction. And the sampling strategy I had at the time was to sort of patrol the beaches and interview fishermen and find out what's going on and how they relate to the environment. But I'd go to the beaches and I'd see nobody. And I was like, well, I'll change tack. I'll go to the different houses and I'll do household interviews. And I'd go there and they weren't in. And nearly all of them were farming. So I was a little bit sort of conflicted by this, thinking I might have chosen the wrong site. But the point is, a blue community, just because you live by the sea, doesn't mean that you're all fishing and that you're all heavily involved in it. It's just part and parcel of who you are, what you do. It doesn't necessarily define you. And around the same time, there was a lot of work about how the coastal environment relates to people's well-being, and in particular, how you can use and manage the natural environment of the coast to alleviate poverty. And they were finding something that I think sort of made sense to me in terms of why we need to understand a little bit more what a blue community is and was. Is that they said, well, if everyone's very dependent on fishing, on fishery, on the blue economy, for example, if you improve the health and the status of the coral reef and of the fishery, you should improve people's well-being and help lift them out of poverty. But a lot of work was showing that actually improving the health of the seas and boosting the number of fish wouldn't actually necessarily bring people out of poverty in the same way. Sometimes actually improving the environment had negative impacts on it. I mean, the one that I saw a lot when I was in the Philippines is that, of course, if you improve the fishery, then some people, it make a huge increase in their well-being. For others, very little, and that would make sense if they're farmers. So, I mean, this happened quite a lot, and I think just starting to understand what a blue community is and how they relate to the environment is very important. It's important for, at the very least, one key reason, which is, if you want to manage the environment in a way where you boost well-being, you need to understand how people relate to the coast and to the sea. And it felt to me that there were a lot of assumptions about that when people researched blue communities, rather than actually much evidence. And so I was part of a project called Spaces, which is about poverty alleviation through coastal ecosystem services, and this is now in East Africa, where we looked at this kind of conceptual framework to try and unpack some of this, try and find out why it is that some people benefit more and some people benefit less when you actually make the environment better, supposedly. So we started on the right-hand side about considering people's well-being, whether they're poor or not, multidimensional metrics, what they perceive as important in the environment, how they access the natural environment and the benefits it produces, their values of the different goods that the coastal environment produces, to try and really find out why this is happening. And so when researching these blue communities in Mozambique and in Kenya, we did a number of things. We first of all took a multidimensional well-being approach. In this example, it's material, subjective, and relational. But we had a big focus on multidimensional poverty as well. So we sort of mapped these different dimensions onto basic needs thinking, so we can actually categorize people as whether their needs are met or their needs aren't met. And we're talking about very basic needs here to sort of give us an idea of who's poor and who's not, and how they depend on the coast and the sea and what it means to them. One of the key things we did, and sorry about the crude images, is to disaggregate communities. So we wanted to realize that people have different needs and wants. The classic one by Richard Layard, highlighting that obviously if you get an extra £5 from fish, if you're incredibly wealthy, that's going to make a very little difference. Whereas if you're incredibly economically poor, an extra £5 from fish is going to make a huge difference. I think this is, in some of the previous talks, this distinction between needs and wants might explain some of the patterns as you're moving away from the coast or not that we saw earlier on from Ben. But again, same in terms of food security, if you're a farmer and you have access to agricultural produce and there's more fish in the ocean, it's not going to make a big difference. But if you're food insecure and you're dependent on fish as your key source of protein, then it's obviously going to be a much bigger deal. But actually not that many people had been disaggregating, not many people had been using a well-being approach sort of 10, 15 years ago, and often communities that were by the sea were sort of assumed to be rather homogeneous. And the other thing we did, and I know it sounds really silly, but very often people go to the coast and like, right, let's talk about fish. Let's talk about fish now. I've got 100 questions about fish, let's go. But actually, a lot of these places didn't necessarily go fishing. Sometimes it was about using the mangroves for different reasons. Sometimes people perceived the fact that they were by a beach was very important for tourism. And we just asked people, actually, what is it about your environment, about being here, that is important for you to live well? And some rather weird things came up, like mangrove trees providing shade, being able to do dyes, using the mangrove forest as a place where they can make honey. And there were loads of these different benefits that kept on coming through that were maybe a little forgotten. That all of this in what you call a traditional blue community. So putting all of this together, disaggregating, considering multiple aspects of the coast, not just fish, but all the other benefits that it produces, and considering people's needs and people's wants, I really felt at the time that we were sort of finding out more. We were researching blue communities well. We were going into a lot of depth. But it actually created a hell of a lot of mess. This is, on the top, you've got the different basic needs. On the left, you've got the different sort of coastal ecosystem services, if you will. And in the darker green, these were focus groups that we did at each site. We did a couple at each site. I think it's about 16 in total. We got these focus groups to sort of score out of 3, I think, how important these different things were for their well-being or for their different basic needs. So if it's very dark green, that means like almost 100, everyone gave it the top marks, basically. This is the most important thing or an incredibly important thing for this basic need. And if it's very white or if it's 0, that means no one said it was important for those basic needs in that community. I'm not going to dwell on this for very long. Of course, the classic ecosystem service goods or aspects of the coast or of the sea that you might expect are there, octopus, fishing, shells to a certain extent are all incredibly important. Mangrove poles were also very important as well for different aspects. But what I wanted to highlight is some of the less likely contenders, the things that people don't tend to study quite as much, like the shade that something produces, the fact that people use the mangroves, to go to the toilet when there's no running water, all of these different things that don't get talked about quite as much because you can't quantify it. I mean, if there's just one tree, an ecologist doesn't care about that. There's not a huge biomass there. Why are we going to have a team of ecologists just to go and count one tree? I mean, these kinds of things get forgotten, but just because it's one tree means it doesn't mean that it's not important for their well-being. It might be incredibly vital for fish traders to stay in the shade waiting for the fishermen to come back. It might be of cultural value. It might be a place where everyone rallies around to have discussions and share information. So there's a lot of different parts to this. And what was clear to me is that there are different, less talked about coastal and marine goods or ecosystem services that contributed to people's well-being and in this case helped prevent people falling into poverty and might have alleviated it in some cases. Another thing that happened from disaggregating all of this is to find out that there were different groups of people, and you can see here in brackets well, on the left-hand side, all the activities that people sort of stated as being part of a blue community. In brackets, you've got the number of people that are doing that activity. I think we had about 1,200 or something like that in terms of the survey, the household surveys. And what you can see is that when it comes to pole cutting, tourism, fishing, trading fish, it's mostly men involved in that. And when it comes to firewood collecting, seaweed collecting, trading firewood, cleaning, it's mostly women. And of course, it's quite quick to see that the economically interesting activities are predominantly done by men in this instance. And of course, we spent loads of time going back to this and then using this to try and find out how different groups of people are actually deriving different sets of benefits from the environment because they're involved in different activities. So we spent actually about I guess maybe 5, 6, 7 years doing this kind of work with a bunch of colleagues here in Streatham and in Sweden, Mozambique, Kenya. And it is messy, it is complicated, and I did have a bit of an existential crisis thinking about, was this actually worthwhile? I mean, what did it actually say apart from paint a slightly more complex picture? And we tried via a variety of different publications to try and sort of sum up and explain why it might have been worth it. And I think one of the things that really shone through is that, of course, you need to understand how people interact with the environment, with the coast, with the sea, before you make sweeping generalizations, because we see time and time again the unintended consequences of certain environmental management or marine spatial planning or conservation interventions more generally. So I think at its core, it just painted and added a bit more to this picture of how people relate to the environment. And we really sort of started to distinguish between the ways in which people benefited from the sea and the coast. Some of it was by using, and I would say, and this is, I mean, not published, so don't maybe write this down and quote me on it, but it seemed from the data that a lot of what came out was those that are doing really badly used directly many aspects of the natural environment. They used fish for food. They used firewood to cook. And then some used it for money. Of course, money is such an important aspect. Some used quarts of firewood. They then sold it for money which they could buy something else with. But there was something very interesting about people using things directly for their own needs and people selling it for their own needs compared to others doing things for their wants. And the ways in which people were engaging with the coast and the sea tended to differ when it was needs versus when it was wants. And there was, of course, experience. Just the practice of fishing, for example, led to mental health benefits, obviously not when there are storms, I'm sure, but generally being that sense of freedom and not being tied down to rules and spending time fishing with friends or chilling out under the tree of the mangroves or whatever, waiting for fish to come back. All of that contributed to their well-being quite significantly. And that has another repercussion, because what we're starting to see and what we're starting to find is that the ways in which you benefit from the environment have implications for whether you're a steward of the environment as well. So if you're trying to solely fish for money, well, money is arguably sort of it's something that you continuously want. It's not sort of exhaustive. Whereas if you're fishing for your food security, there's only so much fish you can eat. And we're starting to see these patterns if you're fishing for experience, and it doesn't really matter how much you catch. So the ways in which you engage with the sea does also play a role with how you act towards it. And I'm not saying that one way is better than the other, but it is an interesting thing to think about when people are, for example, marine spatial planning or trying to zone the sea to try and tease out as much benefit, often material, that you can get out of it. Then is it shaping people to see this as a commodity rather than something we should nurture as well? So there's just a bit of a tension and something there and a story there about the ways in which people benefit from the environment and how they act towards it. So all this work trying to unpack what a blue community is and understand that there are multiple well-being dimensions, there are multiple parts of the sea that people depend on and use in different ways, and of course there are different people with different needs and wants. When you know all of that, these sort of win-win narratives that still dominate, especially conservation, but many coastal interventions, about the fact that it's going to be good for the future, it's going to be good for coastal communities, it's going to be good for people's food security, it's going to create jobs, it's going to be really pretty under the ocean, seems like a complete sort of, it seems quite farcical to me, because it's far more complicated than that. And actually by dumbing it down like this, you're really removing a lot of the complexity. And I know complexity isn't jazzy sometimes, and it means that it's a very confusing message. But it might not lead to these unintended consequences, these shattered expectations, and these people that are very disheartened by these sort of environmental management interventions or conservation interventions. And what this work really has been showing is that, amongst many others that are working in terrestrial and marine realms, is that win-wins are actually quite elusive. Trade-offs are recorded more than 3 times as much as win-wins. And this is when simply you think that there's going to be gains for some people and losses for others. I mean, this is trade-offs all around us. We are who we are because of how we navigate them. I mean, that's how we behave, is we see a trade-off and we behave differently. So it's crazy to think that these are actually hidden very often in discussions to try and get people on board, to try and, again, in my opinion, to sort of sell some of these ideas. And so part of the work we were doing, well, in collaboration with ECEHH for quite a few years in Southeast Asia with Matt Fortnam and Jackie here, was really about thinking through these trade-offs and putting trade-offs up front. Rather than leaving them hidden, and let them happen after 2 or 3 years, is to say, actually, there are going to be winners and losers. There are going to be some people that are more happy and some that are less. There are some people that have more to gain and less to lose, or more to lose and less to gain. And we've been working through these tools. It's now online. It's also in a pack that you can download and print out, which basically sets, very simply put, what it does is it sets you through a number of steps. The first one being, who's in this system? What are the aspects of the environment that are being considered here? Who are the different actors? Who are the different types of people that are affected by this intervention? How is this intervention going to change them? Is it going to be good or is it going to be bad? And how are they doing now? And therefore, how do we think they're going to be doing later on? And this is for both people and the status of the environment. And what it does is it helps you visualize these different trade-offs, these winners and losers of the system. And once you've done that, this is where the really interesting and very novel bit that I don't think has been done that much happens is, well, how do we deal with this? Is it acceptable? Is the only way, is the wording that we sort of came up with? Because, of course, it's never great if someone's losing. No one wants to lose. But is it acceptable? And to try and use this tool as a discussion to be able to discuss, well, yes, okay, I'm doing slightly less well from this, but actually it's important for the longevity of this fishery resource and for future generations, and I'm doing okay. It's not going to push me into sort of deep poverty. This, I guess, is acceptable because everyone has to, accept that certain things have to change. And so we're working through this at the moment, and we've sort of developed it online. We're now applying it to this in the UK, actually. We learned all of this from our experience in East Africa and Southeast Asia. It's been quite fascinating to actually use that to create this tool. And we were fascinated, Matt and I, maybe about a year ago when we started talking about this with DEFRA and MMO, and people seemed interested. It's the first time anyone's been interested in my research. And actually what was crazy is that this actually came from, I've never worked in the UK before. And it seemed to apply here as well. And so we're still in quite a few discussions with a variety of different policy actors and NGOs to try and actually use this tool. Now, we've not done it yet, but we've had a number of discussions, and we're obviously going to pilot it a hell of a lot before we ourselves do our own unintended consequences. We want to try and work through and see what the impacts are going to be. But it's just quite nice to know that actually sometimes just because you create a lot of mess by delving in really deep to try and understand something, sometimes you can find a way out and a tool that may be of some use. And so that's ongoing at the moment, but we're still working on it. So hopefully this time next year we'll have some findings from applying the tool. Thank you very much.
Okay. Well, there's loads in there. Questions, comments? Oh, and I'll make sure we see people online as well. So, anyone online, stick your hand up, or in the room? Yes, I see a hand. Hi, Sarah.
Hi, I'm Sarah Crowley, I'm from ECEHH. So when we've been looking at similar sorts of tools, mostly based around social impact assessment, but the ideas are similar, in relation to conservation interventions, one of the challenges we've come up against is that the people who need to implement these tools most are perhaps the people who are least likely to implement them because it means they might not get to do what they want to do. So, any insights for how you deal with that?
It's a really good point. I mean, it depends on who you get to, whether you can put it past with organisations that actually. I think the people that have come to us have actually wanted this because they wanted to be transparent and they wanted to find out what's going on. But of course, we can't enforce this on anybody. And I take your point, and I'm even slightly more worried than your point suggests, which is some people might take it as an opportunity to frame it so that it looks like they've thought about trade-offs, but actually they do what they wanted to do anyway. And I think there's a huge possibility that happens as well. So a lot of the discussion that we're having at the moment is the age-old discussion of who is going to be in the room, who is going to be co-creating this, and who's not. And it's amazing the number of times that we have this chat. And, you know, I spent 10 years working on this MAPTA tool, trying to get through all the intricacies, and then the discussion inevitably comes up to be, it depends who's in the room. And then there's a whole hour-long debate about who's in the room, and I'm like, this is not, I know that's important, but we're never going to get the answer to that. We just need to try and do our best within it. So I don't have an answer to that, but I think part and parcel of the problem with this is who's in the room and whether people want to use it or not, because of course, if it shows that their interventions won't work, then, you know, I think if I was selling it to them, I would say your intervention probably isn't going to work unless you consider trade-offs significantly, or unless you've got loads of money to enforce it.
Yeah.
That would be my way of.
That's of course, yeah.
Yeah.
We've said actually you might find that it's going to be much worse if you don't if you don't look at this.
Exactly. Thanks, Sarah.
Thank you.
Yeah, Rob and then.
Hi, Rob. I work for a little charity called. Have you thought about economic displacements from major actors like oil companies around the coast of the UK? We've got enormous pressure at the moment from wind farms and giving non-financial values to the benefits of these communities.
So offshore wind farms has been one of the things that we wanted to actually pilot this tool with, because it would be such a visual representation of trying to weigh up these different pros and cons, having certain actors making as much profit as they can, some others maybe livelihoods fundamentally, you know, negatively impacted in such a way that the future viability of them being fishers might be, you know, put in check, etc. One of the parts of the tool that we come up to towards the end is about whether, if there is a trade-off deemed acceptable, unacceptable, can you compensate, mitigate, or transform and change into something else? And I think what that does is it opens up the discussion for maybe, you know, is it okay if we compensate these fishers for the negative impact it's been having for, and then actually then that becomes a discussion. You maybe almost go all the way back to the beginning and say, right, there's compensation here. Is it acceptable or is it unacceptable because of the well-being impacts? So it allows that discussion, but we've not done it yet. But it is, wind farms is one of the key areas we wanted to actually use the tool in. So I think hopefully a perfect exploratory way to start using this tool anyway, and try and showcase some of those trade-offs. Yeah, no, thank you.
Karen?
Yeah, it's just to follow on to Sarah's point about who's in the room and who uses. So is there any mechanism actually in the tool to address those sorts of questions? So, like, I guess I'm thinking of something like Phoenix One, which is a very process-oriented tool, where certain things have to have been considered transparently about who's taking part. Not saying that's a perfect tool, but I just wondered whether you've thought about making it part of the tool.
We have vaguely. I can see Matt sort of shifting in the background as well, because Matt you know, really played a huge role in developing this, but also in developing a different tool that we use as part of the community. It's called NetMap, I think, which is all about trying to identify, you know, quite a sort of lengthy process to identify all the actors involved in a certain situation, but not only who they are, what they do, but also their level of influence. And we really sort of thought that actually, once we've sort of got people onto the MAPTA tool and are really keen to try and use it, maybe we could add in a sort of step before that. But again, a lot of the organizations we're working with have their own steps, have their routes already, but all of them have their flaws. But it is something we are seriously considering, because of course, a lot of these problems are because you've got the wrong people in the room, or all the right people, but only one person's talking. So that sort of degree of influence and mapping, you know, stakeholder mapping exercise would be a really useful addition. And I think as we start getting freaked out about applying this tool in real life, we'll probably turn more seriously to that. Yeah, thank you.
It also just occurred to me as you were talking, worked years ago with theory of change. I think that has quite a lot of things in.
I think it's in it.
I can't remember the details, but might be worth looking for.
Yeah, okay, thanks for that.
When you were talking, I was thinking this is really about good governance though, isn't it? So if you have a community that has some good governance systems, that's what it should do. It should get everybody together to discuss the common good. Where's the kind of shared interest. So for offshore wind coming to Cornwall, you know, we need arenas where people come together and weigh up all these really complicated decisions. And unless we have good governance, you know, little tools, not that your tool isn't fantastic, but we're not going to kind of solve those big problems. So maybe for Cornwall and offshore wind, we need to think about action research that thinks about governance and our coastal communities, and what's going to happen to Falmouth and the port and the infrastructure, and then the offshore and the fishing in Newlyn, and try to do something more creative around the governance. I know Rachel and I have talked about this a lot, but that would solve it more, wouldn't it, if there were good governance systems and cultures. Harry's got his hand up online, so unless there's someone, did you have a hand up someone?
Matt was more of a...
Yeah, well, Matt first and then Harry online. Sorry, go Matt.
Yeah, just going back to the stakeholder comment as well. So we're doing some research as part of ROC to understand the current way decisions are being made in the UK. And so we're looking at how that fits into existing processes. But I think we're quite surprised actually at sometimes the lack of good governance. You know, I just was, maybe we've been working in Africa and Southeast Asia, and their stakeholder analysis is pretty robust for programs to understand who you're working with. We're quite surprised actually often when we've been talking to them about the tool that there isn't the stakeholder analysis done. So we're like, okay, we're going to have to do it because it's not been done, which I think is surprising.
Well, maybe that's to do with development theory, you know, that it's development funding. So the governments in the West can tell other people how to do things, but we don't do it ourselves. So maybe it's something about that and who's paying for it.
Yeah.
Be interesting to look at that. Harry, hand up.
Thanks, Tom. Really interesting work. It makes me reflect on, you know, I've done a few sort of end of project assessments or midterm assessments or evaluations of work actually in Mozambique. And I remember one case in which I did a midterm assessment, produced a draft, and it was looked at by the funders, and they said, well, sorry, you've misunderstood. You can't actually conclude that this project shouldn't be done. And I think for people who have done the kind of midterm assessments or evaluations or, you know, that sort of thing, there's often that inbuilt tension. But I'm wondering the extent to which there's something to be learned from the literature, the critical literature that looks at the assessment or evaluation process in development projects. And the sort of broader dynamics that shape what they are meant to achieve, because what you're doing here is proposing the opportunity to say this shouldn't be done or it shouldn't be done this way right from the start. Does that change what's at stake for particular actors? Does it provide a benefit of quality assurance, you know, from the start that's seen as a positive, or is it still a negative getting in the way of the kind of work that they would aspire to do?
I guess that's a big limitation of the tool in a way, because you can't, you know, when you're thinking about the anticipated consequences of things and you're trying to guess about whether it's going to be a good thing or a bad thing for different groups of people, we're just having to make these big sweeping generalizations and not have it based on anything. And I think I think we're still at the stage where we're just using this as deliberation and discussion and transparency and hoping that leads to something better, because in a way we sort of think it must do, but we don't know any further than that, basically. And we don't know to what extent, you know, there's bound when there's that uncertainty and that element of risk of not knowing whether it truly will be a good thing or not for other people, because some people are scared of change, for example. So it doesn't mean that change isn't good just because people say that they think it's going to be bad for them because it's going to change. So we don't know whether it might just lead to some poorer decisions being made or not based on it. And I think that's a big risk. And I think thinking through the literature on assessing costs and benefits, especially in the changing world, would be very, very useful for us, but not one that we've necessarily done yet. We're just surprised that there's no transparency about trade-offs, really. There's costs and benefits, analysis, but there's not this idea of winners versus losers, this idea of fairness and of equity, and anything to deal with acceptability, regardless of whether you can say it with certainty or a high degree of uncertainty or not. And so we're hoping that at least by discussing it, we can make that a little bit more, at the forefront. Just like people say, oh, have you done a social impact assessment? They could be like, oh, have you considered the trade-offs, at play here? But again, whether it does huge amounts of good or not, we still need to pilot and continue to think through that. But yeah, thanks, Harry. It's a lot of food for thought still for us.
Well, thanks everybody. I think our tea and cake is calling. With apologies to everyone online, we're going to have a 10-minute, just over 10-minute break for tea and cake. So I'll turn the sound off from this end. Tea and cake is outside. Chance to talk as well and mix and make friends with people. And then we'll be back in here by 22 to carry on with our final panel, if that's okay. So a big thanks to all our speakers so far.
No,
Or is it for everyone?
it's for everyone. It might be.
Yeah, there's not so many of us now, so we could just pile in.
It's classic. As soon as it gets a little bit more participatory.
I know.
Yeah.
Do scooch in if you like, but you can keep to the more introvert. Yeah. Okay, welcome back, everyone. Welcome back, everyone. Thanks very much. So, really a warm welcome again back, and thanks very much to the great talks. I'm sure I speak for everyone that they were fascinating. It was really interesting to see the range of research done and learn about all these different communities and different ways we can think about well-being for communities in the broadest sense, and also coastal communities in the broadest sense, as Tom introduced in the end there. So we keep it really open, but we are really lucky today to have two guests with us who come from the practice and policy side, from the real world side. And I think most of us work in research that is meant to be directly useful for policy and practice and directly speak to it, and we want to be directly informed in the research we're doing in the kind of challenges that we'd like to address. So this is a really important part, and we're really grateful that you can be here with us today. So I thought we'd just start with if you could introduce yourselves to us and just start with some reflections you might have on what you heard today. And I don't know, Paula, would you like to start?
Okay.
Yeah.
Hi, everyone. I'm Paula Chappell. I am a public health practitioner with our Cornwall public health team in the local authority. I focus mainly on social prescribing, mental health and suicide prevention, and that's kind of why I think we had a little warning about the fact that we might be mentioning suicide prevention. Nothing in any detail, and really, if anything, it's sort of data we will be mentioning, but it's worth knowing that, you know, sometimes that kind of conversation can be a little bit upsetting for people, and to know to seek support if it does upset you in any way. And mainly my career has been in health in Cornwall for about the last 25 years, but has for the last few years been in public health. So it's quite interesting that it's gone from sort of treatment services right through now to then it was health promotion for quite a lot of years, and now it's health prevention. So it's really moved right through that cycle, and now we're really thinking about the things that cause ill health and health inequalities, and about how we can work to address those and sort of really support our communities that are very different across the county. And I was just kind of thinking of, you know, as reflecting through the talks that we've had so far today about how there's such crossover with all of our work, and how it's really interesting to hear that sort of national data presented by Ben earlier on, and about how we look into that on a bit more of a granular level within public health, and really sort of put that into practice with supporting our communities.
Okay, thanks very much. And
Hi, I run a little project. It's called Fishing Animateurs. We use the word animateur. It's a French word. It really comes from the circus, and it's about teaching tricks. So we work with fishers all over the UK, and we try and help them to grow their business. And we started a few years ago. Now we do about, DEFRA say we do 80% of all the UK grant work comes through our little office in Newlyn. We work to try and help fishers whatever stage their business is at. The biggest bid I've written this year is 36 million. The smallest is £615. And you're in a unique position of recording the death throes and collapse of English and Welsh fishing, because it is coming to the end of a very, very steep decline. And it is falling off of a cliff because none of us I don't want to be too, Rachel tells me off, none of us are helping the industry because Cornwall produces 52 species of fish. And when you look at the data, the fish we eat isn't British fish. We produce £26 million worth of fish in Cornwall. And of that, when it's added to, when it's fluffed up by the margins, it comes to about 1 billion. 600 million goes to France because they value fish and eat it and will know a megrim. 100 million goes to Spain, 60 million goes to the Netherlands, and the other big chunk goes to America. That's where our fish goes, and we eat a tiny sliver of it. And the fish we love is from Ecuador and Vietnam and China. So bassa, when you go to the chip shop, fish and chips, you're probably eating great big fat Vietnamese catfish. I'm not saying everywhere, but when you look at what comes in and what goes out, and the imports we bring in is 3.6 billion of prawns and other things which are labelled through soft labelling. And it's caught on a world market, it's caught in the Pacific where there are no rules. And then with our own inshore fishermen, we have them under a microscope where something like £5,000 per fisherman is spent on enforcing what that fisherman does. The Cornwall IFCA is 1.2 million, that and the 700 fishermen. So my maths aren't brilliant, but that's about £4,000, £2,000 per fisherman. Then you add the MMO, that's £3,000 per fisherman. So they are more measured than the fish they catch. I have said enough.
Yeah, really interesting. I'm opening it up for any questions and comments.
So sad.
Yeah.
So the realism is we can't easily access local fish because most of us shop at a supermarket, and most supermarkets other than Morrison's are shameful with their frozen thawed fish that they sell. The biggest fish landed by volume at over 200 million is mackerel. And we talk about diets, and I think oily fish is well established as an important part of a diet, but most of us, including my family, is a tin of tuna. That's the most common things. It's tuna and salmon are the things we buy. All the salmon, 700 million of salmon is farmed. There are no wild salmon. So that's how we are. Our work is only possible because of Trinity House, the fishmongers, and King George V Fund. So they give us money to put a team on the ground. And we go and work with small communities. We've just been working in Stades, which is 7 fishermen and a great history. But their crab is less than £2 a kilo landed. There's no money at £2 a kilo. And most of that crab, 2 specialist markets for crab and other marine mollusks is China. So, yeah.
And it's so interesting thinking about our broken food system. Like we work in the Caribbean, I work in the Pacific. It's everywhere the same. It's in the Caribbean, local fish is pretty unaffordable. It also doesn't have high social status, and people I work with in Fiji, they prefer the tin tuna over the fished fish, but also that's their livelihood and that's what they sell off, and then they can afford the tin product. But there's so much wrong within the system, and it's this global experience.
Yeah, it's wrong at all levels because Seafish, which is the body for branding and marketing, its board is made up mainly of members of major importers. So hence the biggest campaign we have is for chip shops through Seafish, which is selling imported.
Bring you in. You had your hand up.
I was just going to say, what can we do, Rob? How can we save the inshore fleet and make it viable and allow access to it? That we, because it's just not obvious when anyone who doesn't care about fish does not know it was coming from the inshore fleet, and or they treat all fish the same and don't recognise, actually a lot of the inshore fleets bring quite sustainably.
Yeah.
So how do we,
We need some bright minds to help people do branding and marketing. Remember, fishermen are mainly fish. I work a lot with fisherwomen, and they take the term fisherman as a term within the industry. Fishers is not a term that they associate with, but female fisherman is fine. But they're up at 3. They catch the fish. They bring it back. That's what they do. They're like farmers. They abdicate at a gatepost for. But we need bright people to give it a value, and also protecting our coastline. The oil companies and the wind farm companies will come in with very smart people with very good PR stories, and you've got the Crown Estate who see a great big pile of cash, and the fishermen end up being excluded, and all sorts of fancy words are used to kick them out of the big area with no thought to what their future thing should be. And a cash payoff is fine, but what does it do for communities, for that countryside capital of small ports and harbours, when it's not full of fishing boats and it's just full of plastic?
For a long time, I had used the MSc certification as a tool, as I think many people do, for how good it is to eat something. And of course, mackerel often comes up highly. But I'm assuming that doesn't have factored into that tool is not a social aspect, or maybe there is.
Yeah, no, there isn't. That's really fascinating, because one of the common species we've got around the southwest, when you look at it on the tool, John Dory's don't score well on anything for thing, but locally, and it's a very common fish, and there's that balance to be found between what's on the MSc and acceptable. But even on those, we're not touching the volumes we need to eat. That displacement needs to move enormously. I think the figures are 8,000 tonnes a week of fish are eaten, and a tiny sliver is UK landed. So yeah, it's really complicated, but getting a strong voice. Fishermen would rather die than collaborate by their nature.
And who would you, maybe that's not very positive, I don't want to say who would you blame, but who would you need to convince, without branding as a way out then? But who needs to be, say we're able to do a lot of research highlighting that, yes, okay, fine, it's only a couple of fishers. I know it's maybe a reduction of your imports if we sort of, bolster them, but actually the long-term health and well-being impacts on those fishers and also the coastal communities, it's going to look like this. It's going to be terrible. Here's the fancy, just a little plug there for the trade-off tool. Here's a fancy trade-off, and this is unacceptable. We need to do something. Who would we talk to?
I think it's political, and it needs DEFRA policy. That many people in policy keep their heads down, because anything too far raises you politically. So it's quite a tricky area.
So you seem to be saying that one of the big solutions is to market these to local people or UK people as eat Cornish, eat British, but I think that's a really important aspect of this. But even if that happened, it still wouldn't be an answer, because I think all of this is so interconnected, isn't it? So people's behaviours and food behaviours. So, eating out of tins, eating salmon, you don't have to do anything to that fish. And a lot of it, I think, is a lack of knowledge. I eat some fish, not much. I'm mainly vegetarian, but if I do eat fish, I haven't got the first clue how to cook it. I don't like fish with bones in, because I'm frightened of that, because my mum nearly choked on a fish bone. But I think these things are really quite powerful in people's food choices.
Yeah, definitely.
So I think it's also about eating behaviour and culture and what you're used to and what's easiest and cheapest. So I think, again, it comes back to equality, doesn't it? Who's been taught how to cook, who's got the money to buy nice, local fish and, all of that.
Yeah.
for me, all of these things are completely interrelated, which makes them really hard to resolve.
Yeah.
But if I saw something in the supermarket saying buy Cornish, and with a bit more knowledge that you've just given me, I'll certainly be more aware. And it would be nice to see that.
We're just starting a project that we've done before called Net to Plate, and it deals with year 5 and year 6 students, and it brings them into the port for the day, and they follow the journey of fish from how it's caught right the way through to cooking it and tasting it and taking a poster home that explains fishing. And I think that will have long-term things. And when I talk about the end of the inshore industry, there aren't a lot of new entrants, but it is a fabulous place for bright young people to work. That's why Women in Fish is so powerful, and that's just being funded to go national to promote the value of women. Because every business I know in fishing is driven by women. They are the brains behind it. Although a third of our fishers don't read or write well.
During lockdown, there were lots of people innovating, weren't there? People setting up their own, selling from home.
Yes.
Is that all gone?
Well, it nearly killed them because they realised there was no market. But you're up at 3, you're catching your fish.
Then you're trying to sell it.
And then you're trying to sell it. I remember many of the overlap is great because many of these fishermen, when I chat with them, and I've done 1,000+ interviews with fishermen, it's opioids that keep them going. Over the counter opioids. You got chemists in any fishing town, and that's his best customer. Because they mix them, they grind them up, they mix them, and they make a cup of coffee that blow your socks off.
That makes a difference.
And I see cases of Red Bull going on to literally cases.
So fishers are not eating more fish.
No, they're not. They're not. The work in Scarborough was wonderful. They got one of the health workers to ask them all when they're going on the quay in the morning what was in their bag for the day. And it's all what the 24-hour garage sold. So it was microwave burgers, microwave things, and snacks. And that's what fires our inshore fleet. Because no one's making them a packed lunch. They can be chaotic. Their lifestyles can be chaotic. Hence the overlap into health and well-being. It's huge.
We're talking quite a lot about fish, but part of ROC, we're doing some research talking to policymakers about kind of how they make difficult trade-off decisions. And I think something that we're reflecting on is that a lot of, say, the environmental aspects are covered in law. So when a decision's made, you can't break the law, you've got to comply with it. And so when you're looking at like wind farms and things, you've got your habitats regulations and blah, blah, blah. But then when it comes down to the social, particularly the small scale fishermen who can't read and write, probably don't think in the consultations, they're getting squeezed out all the time. And the question is about how can the policy environment be more enabling, and do we need laws around rights to protect?
It's hard. Well, remember, you've got very, very, very powerful lobbyists in the wind farm industry, from the big banks in America, who are as smooth as can be. And they're the ones influencing and pushing policy. And then they say, there's a 90-day consultation. It's empty words, because it doesn't matter whether the consultation was just one day and it was tomorrow. If you're not prepared and you're not articulate, and often with fishermen groups, their passion will overwhelm their ability. There's some very quiet voices that are really important, and they just don't get listened to. There's a boundary between wind farms being a wonderful breeding ground for fish. But we've got to be so careful. The bylaws we've just brought in Cornwall to protect estuaries have actually taken out of action all the very small inshore boats that can only fish close inshore. So you've destroyed that, and you don't really even know what they were catching. And if they got a better price for it, then they would catch less. £300 a day is the magical figure. If a fisherman can land £300 worth of fish, he can pay for his boat, his fuel, his licence, his harbour dues and everything. And if he can't, he gets behind, he gets into debt. And remember, loan sharking in fishing is huge. Unofficial loans and debt, and then it all builds up, and they end up doing something catastrophic.
Gambling arms as well feeds into that as well, doesn't it? Because we're so into that too.
Yeah, we do if you've got an offer letter from the MMO that we've helped you get, we will give you all the money in cash, not in cash, but by bank transfer. So if you get an offer letter for 20 grand, the grant rate is 80%, which is wonderful. But the reason why they couldn't do it before was they couldn't get the 80%. So we give them the 80% up front through the comms credit union. And then when it comes back from the MMO, they repay it to the credit union. And I do the same with the Kerno credit union, where they've got a bond of 30 grand of our money, and we can play a bit faster and looser. And we've only lost 5 grand. So we gave it to a fisherman for his grant, and he had his offer letter. But the horse was winning. And he put it on a horse. And about 3 weeks later, when we said, you know, you've not done the work, it sort of came out that he put it on a horse, which I now think was quite funny. I didn't at the time.
What did you do, Rob?
Well, we've just written it off. Just written off, and then we paid the boatyard direct for him to make sure that it did happen, because it was a far more complicated situation.
I had a question, and that came through pretty much all of the talks as well. This overlap across the region that tourism is important, and tourism is important in lots of different ways. It can be because it displaces livelihoods or create livelihoods. It can, in the regions I'm working, the best food and produce goes to hotels and restaurants and doesn't go to local communities, but on the other hand, local communities do get employment there. So tourism is kind of seen as a bit of an evil and challenge, but it also is seen that it can be an opportunity. And I was just wondering, any reflections where you think tourism stands in Cornwall? Could it be part of a solution, as a local Cornish produce is obviously sold and could be sold more within the region and then creates livelihoods in a market? Or would there be unintended consequences with thinking bringing in tourism could be a solution?
I think the public sector could be more beneficial for all of our food and fishing, because they own premises that give direct access. So if you wanted a kiosk on St Ives Quay, the one that does ice cream pays 17 grand. Why could we not give a free space to collaborations of Cornish farmers and Cornish fishermen on every quay the local authority owns, or every car park the local authority owns? To say, yes, it would displace a few spaces, but letting them park their stuff there would be great, because it's access to the market. You can walk around Padstow, but there is not anywhere to buy ready-to-eat fish in Padstow or anywhere else.
I think the risk there is it doesn't address the inequalities. Like, there's a lot of chat about blue food and the health and environmental benefits of blue food, but if that blue food is going to wealthy tourists who are coming to visit Cornwall and not to the coastal communities who have the socio-economic deprivation that Ben was talking about, then it's only part of the picture, I suppose.
There's definitely multiple strands to it, isn't there? Like you were saying about knowing what to do with that food when you've actually bought it, and so there's about education as well, so multiple strands there, and that idea that I think someone mentioned it might have been Ben, it might have been you, sorry Rachel, I can't remember, who talked about how people in coastal communities can live in coastal communities really quite close to the beach but have never been, and about how that perception of some people thinking it's not for them, the same way with the food idea about that's not for me, that's not how I eat, and that's not how I shop or feed my family, and about, so there's multiple strands, aren't there, too?
But food banks are, I'll pick my words, food banks are a really, really bad idea. The communities need them. I do not say we don't need to support people, But if you look, the local authority funds the IFCA for 1.2 million, and there's an awful lot of low value fish in Cornwall. Why couldn't we displace that into ready to eat at food banks or whatever should develop from that? And that's because it's political, because you've got politicians who don't want to accept that, but those mechanisms to get fish into society are there. Megrum is a great fish, but it's complex to deal with because you think, what the hell am I going to do with this looking at me? And but it sells for next to nothing. So there are solutions, but it needs joined up thinking.
Yeah.
And the same it links to the health of fishermen, and most will fail the new medicals that are coming in. And new entrants aren't there.
It seems like one option, and that's linked to the tourism question, is about getting other powerful voices in the room. Obviously, hearing the fishermen and hearing what they've got to say, and anyone in the sort of fishery business talking about things. But if one of the issues is being able to, you're saying that there's sort of some kind of slickness and very good at what they do in terms of sort of selling ideas in terms of the offshore wind farms, is actually being able to convince and win over other powerful stakeholders. I don't think what seems to me that the issue is a lot of people think there's a few fishermen about, and they made some bad decisions, and that's just the way the world works. But actually, it's the future of the coastal communities, as you were saying at the beginning. It's a complete change of the way we interact with the sea, from going there on holiday, from just knowing it exists. So I think being able to speak to the tourism board and say, these are the kinds of futures that are actually knocking on our door now. Is this a future that you would like? This is based on evidence. It's not just, not plugging it. Well, if not, then help them. But because actually it's very little from you, which could make a big difference.
Yeah.
And I think, the council is one, the tourism body is another. If you're even looking at this campus, some of the loudest voices are all about marine spatial planning and about conserving our oceans. I mean, they're incredibly well regarded and well seen, and you see them on the news all the time. Maybe we need to change that a little bit, and especially when we talk about the nearshore and further offshore sort of dichotomy here. That this is two different situations that aren't really being discussed as such until very recently.
If I could, I'd love to take the top 10 NGOs, Greenpeace, WWF, all of them, and get them to fund 2 mega lawyers through Eversheds or one of the real big players to say, right, this is the fisherman's friend. This is now our big hitters to actually whack it in at the right level from all the inshore fishermen around the UK. And say, no, you're dealing with, it's like when you get the cease and desist, not that I've had one, a cease and desist letter from, because you've called your shop Sainsbury's local or something. It's having that powerful voice that they just don't have. The NFFO is great, but it's focused on fishing and fish quotes from that.
What would that legal action do? What would it?
It would give them the voice they need, say for wind farms and the rest, to actually take part in consultations and to then feed back to the fishing community and say, look, what do you want to come out of this? If you want a one-off payment of, I don't know, £60,000 per fisherman to give up, and then we'll just turn it all into wind farms. Or do you want it to have a legacy built in, but it's that green pound or whatever it's called.
There is a new network of people in Cornwall called Sustainable Food Cornwall, and they're trying to change public procurement so that all of our schools and hospital and university, all the big players, the council, would source local food in their supply chain, cafes and everything. And it strikes me that maybe they would be a good group to do something around coastal, because Rachel and I looked at this a while back and we're thinking about town and parish councils in all our key coastal communities. They don't engage very much in these kinds of questions. Maybe we need somebody to work with this network of more activistic NGO type people, Sustainable Food Cornwall, with the governance structures around our communities and try and make this thing tie up and the conversation happen. Because the Shared Prosperity Fund is out now with the council. Maybe we could get some funding to try and do that, to get the fish into the supply chain.
Yeah.
Everyone always takes a good idea. I would never imagine anyone takes a bad idea, but no one really does it.
No, the problem is it's helping the primary producer without just helping the foul fish of this world, who will still buy it as cheap as possible, make the margin and sell it locally. It's about that protection and lifting of that £300 landing. I mean, that's why fishermen go to sea when they shouldn't go to sea, is because they haven't got the money and they're not investing in their boat. Double crewed boats are now working single crewed. So when they wake up and don't feel well, the thought, even for any of you, trying to ring and get a doctor's appointment is a challenge. So when you've got up and got out to sea and you've only got intermediate signal and they want you to ring back and speak to someone at some point today, it just doesn't happen. I think the first stuff we did on Newlands, 7 out of 10 needed urgent referral for unmanaged conditions. And that's not much different today, I think, if you went around the coast. I mean, it's much better now because there is support there, but it's still not there. But the mental health is linked to debt and to established debt.
Speak more than I should, but that's an astonishing statistic and really worrying. I was just like to ask you, so apart from the fishermen, who knows a lot about, thank you, that was really interesting, but who else are you really worried about? Which other groups?
And it is different across the county, I think, as well. And it's not necessarily specific to being coastal communities, but particularly when we think about suicide rates, for example, we see middle-aged men reflected most highly. That's the age that we see the highest. And whilst we don't see a high rate for children and young people, it has been steadily increasing. So those are probably our most concerning groups at the moment. And we've had funding, we've had NHS England funding for a number of years to do some specific projects working with particular groups. Some of them have been fishing and farming communities, particularly some of them have been with men. And what we've learned a lot from those programmes that we've commissioned, where we found, and this is kind of backed up by national evidence that we've reviewed as well, in that when working with men, they don't necessarily want to sit across the room from a female therapist and talk about their problems, but actually they're more likely to engage if they have an activity that engages them. So if they're learning a new skill or they're working with some peers on something, and there's a kind of side-by-side activity, that those are the ones that seem to be more successful and have a higher engagement rate.
Sheds, for example.
Yeah, exactly. Yeah, and the work that Chaos Farm do, with sort of like the name of the thing, bush skills, is it bush skills? Where they're kind of building fires and building things. And so we have commissioned a number of projects, to particularly work with those target groups that we are most concerned about. But we keep a really close eye on that as well. We have a real-time surveillance system in the county, so we are able to sort of be quite agile in where we move our support. And I think probably during the pandemic, we were quite concerned about women. We saw an increase in women that we hadn't seen in other years. And that was reflected in some other countries as well. And it's kind of theorised that there were so many caring responsibilities that were placed on women that were kind of coming from sort of both ends of the spectrum, sort of maybe elderly parents and for children, working from home and homeschooling and all of that kind of, multiple stresses. But it's something that we keep a really close eye on all of the time. And it's one of those things that is really very individual. You know, we can talk about risk factors, but it's very individual for people as well. So we have to bear that in mind when we're thinking about, you know, the support that we offer as well.
Yeah, really interesting. In the middle-aged men thing. Is there like any? I mean, I think that's a trend across the UK. I don't know beyond. Is there anything sort of unique about Cornwall and the coastal communities that, you know, cause factors for middle-aged men? Is it just the same reasons that are everywhere, or do you find there's particular things about the livelihoods that men are engaged in, or the circumstances in these communities around Cornwall?
Yeah, sometimes, and we look at that as closely as we can. And you're right, that is reflected across the whole UK, that it is middle-aged men that are the highest rates. And I guess here we have got more fishing and farming communities, so we do see those reflecting more highly in our rates, but also construction workers and that kind of seasonal zero contract hours. And equally, we'll see someone who's quite wealthy and in a really senior position as well. So it's not totally a picture of we see the highest deprivation being reflected in our rates, but that definitely is something that we do see. Yeah.
We did some research. Sorry.
I was just remembering a few years ago I went to a presentation in Cork about suicide from the Glasgow Research Centre. I think there's a big research centre there on suicide, and they were saying that it's not only about the sorts of groups who are at risk, it's about, they had three things whereby people turn the thoughts of suicide into actual suicide, and that was the knowledge, the access, and feeling really trapped that there's no way out. And so that was really interesting in terms of thinking about the actual transition of feelings of suicide into that. But I don't want to talk too much about that because obviously it's upsetting. But
yeah,
I think there's a lot to learn, isn't there?
There is, and it's really it is a really interesting subject as well. And I think often people, the question that I probably get asked most of all is, why in Cornwall have we got such high rates? We've got higher than the England average. We've got one of the highest in the southwest. As the country kind of is mapped out, the northeast has the highest, and the northwest, and then it's the southwest. And so, there's coastal regions in all of those areas, and particularly in the southwest, the highest by a long way is Torbay, and they feature very highly on all sorts of health inequalities, and so we can't ignore the factors, the wider determinants of health. Really, we can't ignore the fact that around education and attainment, and so that sort of leads into that hopelessness that you were kind of talking about. Burdensomeness is another key issue. So when we're talking about what opportunities there are for work, for well-paid work, for then the opportunities for good housing and feeling successful and feeling confident in the work that we do, that all of those things really feed in. So it's very layered and therefore can't really be the responsibility of one agency. So within the county, we work sort of across all of the health and social care system, really, because you can address one thing, but you've really got to try as best as possible to address all of those key areas.
I guess one question is bringing it back to the first talk by Ben. Kind of he ended with this question. So to say we know about these challenges that are mainly around health inequalities, but they're clearly opportunities, and how can we amplify them? And it is to live in a highly attractive county and there's lovely nature, and is it a matter of making it accessible, or thinking in particular ways to create interventions for that, or even in terms of livelihoods, can someone who makes a livelihood through fishing can make them create livelihoods that are also about the coast, the sea, the kind of environment, or is that sort of naive to think the environment is a resource in some way?
Well, yeah, I think that it's a really important resource for any of us, I think, who live here, and there's quite a lot of recognition of how we might be a very different community in the north and east of the county to maybe the west, and so a lot of the there's a lot of change happening within our health services at the moment. With the clinical commissioning group is now the integrated care board, and there's a wider integrated care system around that. And then there's integrated care areas, so 3 areas within the county, and they're each looking at what the priorities are for their areas, what are the demographics or the characteristics of their areas, and then they're having the autonomy to spend their money in ways that really promote health within those communities, and that might be very different in, say, Penzance to what it is in Saltash. So I think that's a real positive move, and alongside that as well, there's lots of community hubs that are sort of springing up as well, so that people are able to access the health and care support that they need within their communities, community hubs, because accessibility and transport, they're also issues, aren't they? When, sort of 50% of our area around us might be sea, we don't have the same opportunities, or we don't have the same transport system maybe than someone who lives in the Midlands, perhaps. So I think those community hubs are going to be really important in order to break down a little bit of stigma for people in terms of accessing the support that they might need, particularly around mental health, but also making it accessible and linking together with each other to maybe support around a physical health need, but that might also then be able to lead on to supporting around something else, which might be like some social isolation or some gambling harms, or managing a longer term condition. So we've been working, public health have just linked with the integrated care board to launch a 5-year programme of work around mental health and suicide prevention, and we're linking it in with these community hubs so that there's already a place. This is a place-based approach to try to support individuals and their families, and really look at those things that make the biggest difference to how they feel socially connected. And within that, then you've got the social prescribing, where there's lots of groups that are setting up sort of like wild sea swimming or coastal walks, or other opportunities like Nuki Orchard, where there's opportunities for being within nature and that blue and green health, and how that can really make an impact.
I guess the question is, as a local fisher, would you see this as an opportunity, and how do our local communities take ownership of, do they think the coastal path is there? So is it
for the tourists?
For the tourists, and the beach is theirs. I guess, I don't know how you think.
No, I think there's. I think the fishers just do what they do and don't value or like tourists. They're a pain that slows you down going everywhere. But there's I don't see integration with them.
I guess a bit of reflection. Obviously, Cornwall had during COVID this kind of huge influx. I don't know how huge, but like a lot of people moved to Cornwall. So, that changes the demographic a bit of the county. And I was just wondering, how that will then feed through to changing health behaviours. There's like maybe different types of people coming in, and I don't know, any reflections on the Cornwall Council. You might be like, oh look, there's suddenly better health in the coastal communities, but actually it's just displacing the local people who be bought out and are now moving to another area, and there's all these people moving down and going sea swimming and having a nice time, and all the well-being is getting better, but actually it's just kind of creating more inequality, and that inequality itself might feed into poorer well-being outcomes for people who've been here, previously. Because I think there's, I don't know, but I presume there's a link between inequality and health as well.
Yeah, a big link. And yeah, you're right. And there's quite really interesting, the report that Ben was referencing, the Chief Medical Officer's report from 2021. There's a lot of information in that about not just Cornwall, but other coastal communities, about how people moving to the coast are, exactly as you say, what is the impact of that? And are we just displacing or the health inequalities, really? And, here we've seen in, I don't know, towns like Penzance, for example, where there were guest houses that are now houses of multiple occupation, and so we're seeing different demographics there, and sort of attracting lots of vulnerable people with sort of complex medical histories coming into the county, and so there's that change, as well as we've got an ageing population here, so we've got a lovely prospect for people who want to come and retire here and sort of escape the rat race, so there's been change. There's definitely been change, and I think it's probably for our data analyst team to say more about what the complete impact of that is. But I think there's a bit of all sorts of different types of change that that's happened.
Really complex to unravel, I think.
Yeah.
I think it's really fascinating. If you look in Newlyn, so many properties that were rented have been turned into Airbnbs. Then at the moment, the Rural Housing Association is trying to get 20 or so affordable houses at the top end of Newlyn. In-migrators have bought these houses and have then got involved in local politics because they're bored senseless and want something to do, and are then actively stopping the local affordable housing because the impact they see on their environment. But they're also very skilled with far better skill sets and far better in a community setting, and are influencing councillors, and more in-migrators become elected into local county politics. And I think this is quite an interesting dynamic of how a community is represented can be twisted. And so many of our young fishers have been displaced to fish out of Brixham or further afield because of housing values, and that's led to complex family challenges and breakdowns because they can't live anymore. So it's complicated.
It seems like what struck me with all the talks is that, not that we were briefed to talk about this, but nearly all of them had inequalities very upfront on most of the slides. I mean, we weren't prompted for that. And in a way, I think we use the term in different ways. We obviously in different settings, those that the haves and the have-nots, and that being unequal. And we use inequalities sometimes as a way to say these people have less than the others, and that's a bad thing. And we talk about that. We talk about that in terms of unequal access to, coastal resources and unequal access to the sort of recreational activities that we might be able to have by the sea, for example. But we also talk about inequality as being, as Matt alluded to, as being a bad thing, potentially in of its own in terms of people's mental health as well. So it's not just about you having not much, it's about the fact that you might have quite a lot, but that person has even loads more. That difference in of itself is a bad thing potentially for people. And then in a way, I think when we've been talking, those very rare instances where we've been talking in a more positive light, has been about how maybe those inequalities could be useful, because there's been inequalities in terms of power. There's more powerful individuals and those that aren't, and maybe in certain instances that can be used for something that might be good. I mean, there's a team of people in Sweden working on a project called ECEHH, which is, I think it's like they're 7 of the 9 key global players of seafood and aquaculture in the world. I think together they control something like, 50% of world fisheries capture, and they have them around a table once every 3 months to discuss what's coming out of research and what can be done differently, because they know that even if they do it slight tweak, that it might make a big change. Now you could just imagine the response of people to that is in two camps. I mean, some people are so angry that they're in bed with the devil, and others are sort of like, well, you just got to go with what you've got, basically. And I've not even thought enough about which camp I'm on, so don't come attacking me. But I'm sort of there kind of thinking about these two approaches. And in this case, being able to maybe talk to those more powerful actors to try and get their support about some of these key problems, trying to actually maybe use the fact that they are bored people that are coming into these communities, actually, help them understand the plight of what's going on. Maybe there are maybe windows of opportunity there that aren't ideal, but could be used in more positive ways as well. All of it within this sort of inequality kind of angle, where there are those people that actually have more and those that have less, and therefore those that have more might have more time, more resources to give up and then help. But I mean, all of that's theoretical, but again, the MAPTA tool can do that.
I mean, one thing I was thinking in terms of, you were mentioning get fishers to cooperate. I think it's the same with farmers and across much of the settings. That's one of the big barriers. But there are some great innovations, and a project we've just started in St. Lucia. There's this great NGO called Helen's Daughters, and it's young female farmers, and they have developed this co-op together, and they're such a great, strong voice and community. And I think a lot of it is battling, and it might be battling with older male farmers and kind of different structures there, but they're kind of bringing this breath of fresh air, I guess, into trying to develop community ideas. And it's not kind of researchers coming in or, I don't know, international organizations. It is actually local farmers who know their land and who know the local situation, and they kind of try to come up with new ways and bring in the community. So yeah, I guess this intergenerational, maybe that's where also there might be an opportunity. I think we should finish on something positive. Just looking at the time, we would have a little more time, but also happy to draw it to a close. I'm just looking at the audience online, if there's anyone who wants to bring any comments. I just spotted a bit higher up in the comments. We actually had a PhD student who worked on, his topic was, why don't the British eat locally harvested shellfish, the role of misconception and knowledge gaps. So there's the link for the paper there in the chat as well. Jackie, yeah.
Just a quick point about something that Rob touched on about this group of people in Newlyn who've taken over some housing, and I think what Tom was saying. I wonder how big a part sort of like non-awareness is. I think a lot of people coming into the area, I see it from like having a chat with my sister about Cornwall and what the problems are down here. There's a lot of non-awareness of what actually the issues are and what the problem is of buying a second home or having, based on tourism, what percentage of the economy. So I think there's a piece there about that. Like how much do these people actually know what their impact is having on local people? Like maybe that's a communication issue as well.
Yeah, I think it's a fascinating and it's a real complex area, because when I talk to second homeowners, they are on their own agenda entirely, and they have a I can't think of the right word, almost a smugness about it, and what is the problem? It's theirs, they buy it, they've got the money, move on. There's a
sense of I've seen this before. It's a sense of they're entitled to it because
absolutely,
yes, in their jobs in London. I'm not trying to London, and then they're entitled because they've worked so hard to earn this money to buy this thing. They're entitled to have a nice retirement.
Yeah. It's interesting because it needs political change. We need to charge 6 times or 8 times the council tax for a second homeowner. But when we had the crisis, most of them that were registered as businesses got an immediate £10,000 grant from the government because their second home, to avoid paying council tax was registered as a business. So they suddenly had yet another economic uplift, and businesses were offered, micro businesses were offered a small loan to pay back over a decade. So, you know, it comes from the very top. We need a revolution, not evolution.
Cornish people are not very well organised either, because the numbers are getting smaller, so Cornish people are being outnumbered all the time. And so there's a sort of sense in which they're less vocal even than when 20 years ago,
Yeah,
in terms of the Cornish interest.
absolutely, and especially young people. Young people are really, because one of the projects I work with is about litter in Cornwall, and the hardest group we find to influence is young people. They cannot understand why a throwaway vape with a lithium battery in it, which are disposable, are one of the highest things we've seen rise in numbers just thrown away on beaches and towns all over Cornwall, tens of thousands of them. So you've got complex electronics and a lithium cell, and you suck on it for a day, and then you throw it away. And so young people, yeah, how you influence and adjust that market. We do 2 or 3 TikToks every week on it, which is the only way to reach them.
Yeah.
It's 2 words.
Maybe on that note, so there's loads still to research, I feel. Be told what we should be researching. But maybe a few really good ideas as well for our next projects out of this. Yeah, definitely. Well, thanks very much, everyone. Huge thanks to Rob and Paula and Rachel and Tom and Ben. It was a really good discussion, I thought.
Yeah, it's great. Thank you.
Thanks very
Yeah,
much.
thanks very much.
Thank you very much. Thank you.